Welcome everyone to the March 6, 2023 Grafton Board of Health meeting. As a preliminary matter, this is Karen Gwiazdowski-Govin, Chair of the Grafton Board of Health. Permit me to confirm that all members and persons anticipated on the agenda are present and can hear me. Members, when I call your name, please respond in the affirmative. Dan Finn.
Dan Finn here.
Austin Magnet.
Austin Magnet is present.
Bill Muller.
Bill Muller here.
And Jennifer Maynard.
Ben Maynard here. We'll bust it in.
Staff and anticipate speakers on the agenda. When I call your name, please respond in the affirmative. Nancy Connors.
Nancy Connors here.
Micah Blondeau.
Micah Blondeau present.
Amelia Houghton.
Amelia Houghton present.
And then I see Cherry Tangri also.
Hi, Cherry Tangri present.
All right, thank you, everyone. All right, I would like to open tonight's meeting. Can I get a motion to open the meeting, please?
Yep, this is Dan Finn. I'd like to make a motion to open this meeting.
Is there a second?
This is Austin. I will second the motion.
All right, and then roll call vote, members.
Dan Finn, aye.
Austin Magnet, aye.
Bill Muller, aye.
Jen Maynard, aye.
Karen Gwiazdowski-Govin, aye. All right, thank you. Good evening. Again, this open meeting of the Grafton Board of Health is being conducted remotely, consistent with the Act extending certain COVID-19 measures adopted during the state of emergency in Massachusetts. This act includes an extension currently until March 31st, 2023 of the remote meeting provision of former Governor Baker's March 12th, 2020 executive order suspending certain provisions of the open meeting law. In order to mitigate the transmission of the COVID-19 virus, the Act extends the requirement of the open meeting law to have all meetings in a publicly accessible physical location. Further, all members of public bodies are allowed to participate remotely. The order, which you can find posted to the town's website at www.graftonmass.gov, allows public bodies to meet entirely remotely as long as reasonable public access is afforded so that the public can follow along with the deliberations of the meeting. Ensuring public access does not ensure public participation unless such participation is required by law. There are no public hearings scheduled for this evening's meeting. For this meeting, the Grafton Board of Health is convening by video conference via Zoom as posted on the town's website, identifying how the public may join. Please note this meeting is being recorded and that some attendees are participating by video conference. Accordingly, as always, please be aware that other folks may be able to see you, and take care not to screen share your computer because, as always, anything you broadcast could be captured by said recording and seen by other attendees. Any supporting materials that have been provided to the members of the body are available on the town's website unless otherwise noted, and the public's encouraged to follow along using the posted agenda unless I note otherwise. Quickly, before we turn to the first item on the agenda, permit me to cover just some basic ground rules for effective and clear conduct of our business and to ensure accurate meeting minutes. I'll introduce any topics and then any speakers for said topics on the agenda. After the speakers have concluded their remarks, I'll invite the board members for any questions, comments, motions, etc. As always, please identify yourself by name when speaking. Please remember to mute your phone or computer when you're not speaking to avoid background noise. And then please remember to speak clearly and in a way that helps generate accurate meeting minutes. For any response, please wait till I yield the floor to you and then state your name before speaking. And then finally, any votes on any motions made during this meeting will be conducted by roll call vote. All right. With that, since I know Cherry's got another meeting to jump to and has graced us with her presence here because of the 2 tobacco violation topics, we're going to do a quick little out of order on the agenda so we can get through those 2 topics first, so then she can go on to her next meeting. So with that, the first topic is the Village Dairy tobacco violation. So Cherry.
Thank you, Karen. This is Cherry, Prevention Specialist Tobacco Booster. When I did an inspection on February 21st, they did not change the price of their single cigars to the new prices, which should have been $2.90 for single cigars. However, their pack of 2 was, they were selling it at the correct price of $5.80 for a pack of 2 or more. So I asked them to change it, and this morning I did a follow-up inspection and they had changed their prices. So yeah, so I think they are all set, and I did let them know that if they did not change their prices and did not comply with the regulations, this would be their second violation, and with the second violation comes permit suspension as well in Grafton. Then can I move on to 215 Worcester Street Ultramart?
Just before we jump to that, where there's separate topics on the agenda,
Okay.
do any of the board members have any questions regarding the one that she just went over?
This is Austin. Was their price too high or too low?
So the price was lower than what is the minimum pricing in Grafton.
Okay. Thank you.
Any other questions for that one? Nope, Dan.
Just quickly, they have a history of issues, and it's unfortunate that they're sort of high maintenance, so to speak, for the inspectors, but they seem to be in compliance at the moment. But I think we have to keep an eye on them.
Yeah.
All right, seeing no one else, then we can move on to the next one, Jerry.
So when I first did an inspection in December for Ultramart 215 Worcester Street, they had over the counter rolling papers, which are now banned in the flavored versions are banned in town of Grafton. So they did have Natty Hemp Russian Cream, which is flavored blueberry, pineapple. At the time, these were the only products, and there were not many. So I gave them, because it was the first time I was doing an enforcement on it. So I gave them an educational warning. And then I did tell the clerk to call her boss and let them know. And also their pack of cigars, the pack of 2, I think that was also not correct at the time. And I asked them to change that. And they do not sell single cigars. And this morning when I did a follow-up inspection, there were completely new products for flavored rolling papers, which were not there last time. Had it been there at the time, I would have told them that these are also the same things. The only, I think, difference was the Natty Hemp wraps. The one I found first time, they were the leaf. They were the wraps, actually, not rolled into any sheet cones. And the ones I found this morning, they were all like rolled, and there were various flavors, lemon cake, and they were 25 in count, and mango flavor, those were 12 in count. And then blue banana 12 in count, mango 1, blue raspberry 1. So the owners did reach out to me via email, and I let them know that it would be a Board of Health decision whether they will get a fine or not, because I have already last time I gave them a warning and they did not take it seriously. And this time when I was speaking with the store clerk, she told me that she had informed the owner, and he said according to him they were fine to sell. So, and then when I told the owner this afternoon that it's the Board of Health decision, then they responded to me saying I should let the Board of Health know that the regulations are very confusing. So they should make a consideration of that. I did send them the Grafton local regulations that went into effect, the amended ones, and also the letter that was sent by Nancy to the retailers back in April.
Board members, questions, comments?
Couple.
Ken?
So when you did education, did you give them anything in writing?
I gave them the copy of regulation. I showed them where it is located, and I did that this morning as well.
And does Ultramart have other locations that you guys check in on, similar to other stores that we've talked about in the past?
In Grafton,
Any of the communities that you work on that they might be knowledgeable if they're owned by the same, or is it multiple places owned by the same person, or?
there is sometimes a possibility that they own stores in Worcester. I did not check with them specifically because the owner kept saying that, Worcester allows it and other towns and cities in Mass allows it, but this is a local policy that each town, it is different in each town and city. So I did let him know this afternoon about that as well. And this does not apply to Worcester, but flavored rolling papers does apply to Grafton and Shrewsbury.
Mhm. And it doesn't matter that it's a wrap or a roll, like what you were describing, it's.
Yeah, because in the rolling paper, if you see the definition in the regulation, it says sheets, cones, and it has
Pretty clear, yeah.
included a variety of products just to capture everything. And it will be, if the board decides to give a fine, I did check with the state, the fine would be $1,000 for the first violation.
Anyone else, board members? Oh, Bill.
Oh, you're muted.
You're on mute still.
It seems to me that it's really a question of intent. I mean, whether they were deliberate in ignoring your first inspection of them. I would understand if they have stores in different towns that have different regulations, that may have led to some confusion. But it is concerning that having given them the first inspection, that the number of products of that type actually increased substantially. So I don't know, it's hard to say what the intent was, or whether it was deliberate or forgivable, I guess. I mean, I don't know. I mean, certainly I think we're on adequate grounds to issue a fine.
I
Does-
think they took it, sorry.
Oh, I was just gonna ask, does the material that you leave for them include your phone number? Should they have any questions regarding the regulations?
Yes, they have my email. I think they usually, how it goes is they email the admin at the Board of Health, and then I get the correspondence. And I usually give them my business card so they can, if they want to reach me out directly. So they did say that they have taken down the products this afternoon and are going to comply. And something that they are also very consistent on not listening is the humidors. Since I have been in this position each time, like for the first inspection, their humidor, the locks were broken, and they were, because it was COVID time, they were not able to get people to fix it. So I just gave them a warning twice, but last 2 times their humidor have been like open all the time. And they keep telling me that I just opened it for to give a cigar to a customer. And because they're a general store, it cannot be it's like an over-the-counter product if it's not closed, and it has to be behind the counter. If it were an adult-only store, they could have left it open.
Dan, I saw you jump
Is
up.
that, Sherry, is that part a regulation as far as self access and not being locked.
Yes,
Is that-
over the counter, yes, that falls under the state violations again for $1,000 fine.
It sounds in a way that you're on stronger ground on that violation than you are on the wrapper violation. Is that something that would vary from town to town?
The
is that
rolling
state?
papers,
No,
He's
the
talking
the
humidor.
humidors being
No.
locked.
that's in the state law, so state law applies to the whole of Massachusetts.
So
Well, the
again, it sounds like you're on stronger ground with that violation.
Right,
The
Yeah.
other thing is the pricing, which they fixed again after she went out. I mean, that's 3 and I mean, I
right.
think we talked about this before in the past too, that, and the reason why I referenced other stores is that we had another situation, I believe, where the people owned several stores and, you know, there is sort of an expectation that the people know what the regulations are or ask questions in the communities versus just kind of do whatever.
Right, so board members, what do you want to do in terms of this, in terms of levying a fine? Not in terms of if we're going to proceed with levying a fine, it would be, you know, obviously if the amount, there needs to be like anything that we vote on, motion, a second, any discussion, and then a vote. So that's kind of the standard protocol. Dan?
Yeah, I know none of us are fond of fines, but in this case, it just seems to me it's warranted on at least one account, maybe 2, and I don't know which you want to pick, but I don't know what everybody else thinks before we vote, but also it's as opposed to someone saying, I'm sorry, I'm going to correct it. It's like a defense of confusion, and that's just not cooperative as far as I'm concerned personally. But anybody else leaning in that direction for at least one fine?
I
of
agree with
1,000?
that.
I would agree.
I would agree.
So someone needs to make a motion.
That being sort of a consensus, I guess I can make a motion that we take a vote to fine Ultramart on Worcester Street, whatever the number is, in the sum of $1,000 for violations over the past couple of months.
There a
I second that.
All right, roll call vote. Well, any discussion first? Let me just lay that out
Do
there.
do we have to pick one of the violations to specifically fine them for instead of just saying fine them for one of them? Like, do we actually have, like, when we're writing it up, do we have to pick one and say we're giving you a waiver on maybe these 2 violations, but we're gonna fine you for this one? Or can we just say that we're giving you a fine for your violations? Does it matter?
I think that would be appropriate response, giving them warning so they know that, you know, if they do not comply this time, there is a fine coming for that as well next time.
So if I can amend that motion, it would pertain to the restocking of the flavored rolling papers in this case. That fine, and that we would put them on a final warning regarding the locking of the humidors and the access to the humidors.
Wouldn't it make more sense to make it the other way around? I mean,
Yeah, it might, except I don't know whether they received, and Sherry, you'll know, a couple of warnings about the humidor access.
Yes,
They did.
yeah.
Does
Okay.
the fine have to be $1,000 for each? if we were to find them, or is there any wiggle room
Yes.
with, it's 1,000 each?
Yeah.
Excuse me.
I was thinking that maybe it would make more sense to fine them for the unlocked humidor, the state violation, since they kind of claimed confusion over the town violation, but now they definitely know. And they said that they've removed them.
So, okay, so I'm gonna withdraw my original motion.
Amend.
Yeah, man.
And the amend, and I guess I'd like to put a new motion out there to fine Ultramart and Worcester Street for not abiding to the regulations of locked humidors and non-access to the general, I don't know, somebody's gonna have to write this up, but for not locking their humidors. And at the same time, we'd like to put a final warning on the rolling papers.
Now, is there a second for the,
I second that. Yeah.
all right, roll call vote.
Dan Finn, aye.
Austin Magnet, aye.
Bill Muller, aye.
Jen Maynard, aye.
Karen Bestowski, open eye. All right. Thank you. Thank you, Cherry. We appreciate it.
Thank you so much.
Never easy.
I have one question. I believe all communication goes from you guys,
Yeah.
right? The ticket and the letters via a certified mail.
Nancy, is that correct?
In the past, a couple times, the Alliance has helped us with it. They are more in tune with the terminology and make sure it's done really correctly, especially with emergencies like this. So sure, if it helps, that'd be great.
Yeah, I can do that. So if I write a template, like, would you like to review it or I just send it?
Maybe get someone to review it, I think, just to see if there's any Ts that aren't crossed or
Okay,
whatever.
okay, thank you so much.
You? Yeah, we don't deal with this very often, which I guess is obviously a good thing for everyone involved. So no, we appreciate it. And like I said, never a good situation to have to discuss.
Okay, I will write the ticket as well and the letter and send it for review. Okay,
Thank
Thank
you.
you. Bye.
Bye. All right, next topic, Alliance updates. Who wants to go first? Micah, Amelia?
This is Micah Blondo. I can go first.
All right.
I actually don't really have a whole lot of noteworthy updates. I think I did 11 food inspections with no re-inspections. I inspected the hot tub place and really kind of no new complaints or anything else, no illnesses. But now we're just kind of getting into springtime and we'll have camp applications and mobile food things and all that kind of stuff starting to come our way, and it's happening soon. So that is my update.
Mhm. Any questions, board members, on any of the inspections? Nope, Dan? Nope, you're on mute. Still on mute, Dan.
Micah, sorry, this is Dan. So the last item on your list was an as-built on 8 Miriam Road. It says issue COC. What does that stand for?
COC is Certificate of Compliance.
Okay. So is that something that the planning board gets involved in?
I'm actually still learning Title V, so I would have to check with Phil Legier. He's the one that we've kind of
Yeah,
been helping
gotcha.
us on the Title V
Okay,
No, this is the final step. When you do a new septic system like this particular one, you do your inspections, and the very last thing is to review the as-built and
Yeah.
issue the COC, and then
I
it's
see.
filed away. Done.
I see. Issue the COC. I thought there was an issue with or something, but anyway.
Not
Okay.
a bad issue, just
Right,
issuing.
Right, okay. I got it. Thank you.
Any other questions for Micah? If not, we'll jump over to Amelia.
Hi, Amelia here. So let me start with this. Last month, we started adding extra blood pressure clinics to a second housing authority site. So now we're going to 10 Maxwell Drive, which is, the office building, as well as 9 Forest Lane. So both are once a month. And separate days. So one's on a Thursday and one's on a Tuesday. So we try to mix it up. And we're still going to the Grafton Senior Center once a month on a Thursday. So we try to divide the time out between those areas. Also, I have a COVID clinic planned for this Thursday at the Grafton Senior Center, which started out as seniors only, but there doesn't seem to be that much interest in registering online for it. And we put notices out and sent out links, and Nancy posted it and Shannon posted it. So it's open to anyone. I have 40 slots available. Well, 39 available as of today. And it can only mean either people are still not aware or already have what they want, but it was worth trying, even with the gift card incentive. So we'll see how that goes. That's I think it. Just FYI, when I was looking through the COVID report for Grafton in the last month, since beginning February to now, I see that there have been approximately 37 cases that were state reportable, obviously not including anything from a home test. But age range, mainly 9 to 92. So it's still out there, not as much, but there's still some out there. That's about it, unless you guys have any questions.
One question I had that I've been hearing people both personally and non-personally talk about is norovirus rearing its ugly head again of late, along with resistant Shigella, which is more of a newer one, but the norovirus, I know it comes up every so often. What you've been hearing, especially, I mean, the norovirus, like I said, that one you see
It's going around
rather frequently. It's not as odd as the resistant Shigella.
Right.
So I didn't know what you had heard.
Yeah, lots of norovirus going around the towns, the city, everywhere, and in groups. Seems to like company right now. So yeah, it's pockets here and pockets there. But luckily, it's contained to like a facility or a site. And with clinical people in place and clinical managers and directors, they know what they're doing. They're in touch with the state. They're in touch with us. It's under control. So we haven't come across anything that's out of control.
Any questions or any more questions besides mine for Amelia?
Karen?
Yep.
Dr. Muller had questioned the COVID-19 deaths in Grafton. Do you still want that information, or did you get that?
I thought you would send something out, Nancy.
Okay, I don't remember. So you're all set, good.
Yeah, I think your list is more accurate than what I can get from Maven. I remember we compared our notes last month, and what you were able to show me was far more accurate.
There's nothing else for Amelia or Micah, then guess we can jump to the next topic, which is COVID-19. Amelia already covered the past months, just I'll give the classic running total that I've been giving. So as of March 3rd, Grafton had been informed of 4,148 confirmed positive COVID cases since we started tracking back in early 2020. And then, you know, as Amelia already said, you know, that doesn't include home reporting. Those are actual like reported cases to the state side of the world. Kind of, I would say the standard world of taking precautions still, making sure if, sorry, if you're immunocompromised or live with immunocompromised or come in contact with immunocompromised or elderly or anyone else who is more susceptible to COVID-19 or the flu or RSV, any of what's still going around at this point in time, to definitely take increased precautions with wearing of masks, especially in the crowded indoor places. Spring is coming, so at least hopefully we can start having more outdoor activities again, more outdoor dining again, but we're not there yet, especially if you look at the weather forecast for this weekend into next week. So definitely still out there, as Amelia was saying. So, and then vaccines are still available, boosters, the flu vaccine is still available in locations. So definitely not out of the woods yet, and still are dealing with COVID, flu, and some RSV still. Any questions, board members, on the COVID side of the world? Bill?
Yeah, do we have any information now that the federal emergency declaration appears to have been, completed? What the impact's going to be in terms of immunizations? You know, the immunizations heretofore have all been pretty much provided by other entities. You know, I don't think people have been paying out of pocket for immunizations. But I would think at some point, if there's no longer a federal emergency mandate, then that's going to change.
Yeah, supposedly, I think in May, they're making that decision. I know the gift card incentive is ending this month, the end of this month. And I think in May is the cutoff where it goes from state supplied to possibly private. And then depending on your agreement with the state, how they allow you to order it. So I will finalize that and get that information to you at the next meeting.
Thank you.
Any other questions? No. All right, then we will jump to the next topic, which is the rabies clinic, which is scheduled for April 1st with Tufts. Dan, you've been the one kind of helping push this along. So if you want to give us an update, please.
Sure. Yeah, Nancy and I had a meeting with the two students that are co-chairs of this community outreach group from Tufts, along with their professor, and it was very productive. And we have set the date, and there's a flyer just about to be finalized. It's going to be on Saturday, April 1st in the morning, and I don't have it in front of me, unfortunately, but it's going to be from like 9 to noon. And Nancy, correct me, I think 9 to 11 is going to be dogs, and then cats and ferrets are from 11 to 12. And there's going to be a sort of pre-registration or appointments of ideally with 3 veterinarians giving the vaccines and giving a checkup. I think they also plan to have distemper available if needed, if wanted. And the town clerk will be there and a maintenance person. The town clerk's hours might be different. I think it might be like 10 to 12 or 9 to 11, something like that, but it's all going to be on the poster. The one question that we have tonight is whether to charge the public, these people, for this. Tufts is donating the vaccine and their services, and as part of a collaboration with the town and giving back to the town. And so typically, I believe, and those of you who have pets will know better, whether one of the 2 shots that last 3 years might range, I'm guessing, $35, $50 or something, and that depends on where you get it, obviously. So I guess the question we have is whether we should just charge and not charge at all, make it free, or charge something nominal like $10. I don't know what everybody thinks about that.
One question on the charge, where would the money go and what would it be used for? Where Tufts is donating?
Right, it would go into the, I think it would go into the general fund. But it might be nice to have a free clinic. I'm just thinking it might, we might get walloped with people, but in that there are reservations, so to speak, I guess that can be controlled if it's free. Any thoughts?
Dan, you are correct. Everything you said about the date, the time, town clerk, all of that is correct. The flyer is ready to go.
That's
We
good.
just need to know what to do with the fee. Now, general fund, I don't know. I have my own list for the Board of Health and account numbers that I return my money over to. I don't have a general fund account.
Bill?
It would seem to me that people from the Tufts Veterinary School are providing these services for free. It would be awkward for us to charge people for them.
Mhm.
I mean, I think this is in the spirit of, giving back to the community that they happen to reside in. So unless there's a precedent for charging it, I would think it would be appropriate not to.
Yeah, that makes sense, and that's perfectly fine. And there aren't many free clinics for anything. I guess there were for COVID vaccines in a sense, but in any event, yeah, it could get tricky and come back to bite us, so to speak, somehow. And that's perfectly fine with me. I don't think we necessarily need a vote, but just a consensus if that's okay to have it free advertised. And I think it should be just Grafton residents too.
Mhm.
Yeah. I think that'd be great.
So Nancy, it sounds like free as it is. No fooling on April 1st.
Right. I will get in touch with Tufts tomorrow morning.
Great.
Thank you both, Dan and Nancy, for getting this coordinated with Tufts, and we're able to offer again to the town, which is a good thing. All right. Next topic is a chunk of 1, 2, 3, 4, 5, 6, 7 sets of minutes from previous meetings. So I know Nancy had sent out to the board members the various minutes. I know I had reviewed them and provided her just with a few minor comments and changes, typos, that type of thing back. For each set of minutes, we need to have a motion, a second, and then a vote to accept each set of minutes. We can't do a blanket kind of thing for all 7 of them. So I think the first, Dan. No, I don't know if you were still off mute, so I didn't know.
Sorry.
No, that,
Just wanted to see if someone that wanted to lead off on these. So,
all right, so I will start August 15th of 2022.
Okay. So this is Dan Finn. I'd like to make a motion to accept the minutes of August 15th, 2022.
As written.
This is Bill Muller. I second that.
All right, roll call vote for accepting the motion and the second as, but the minutes as written.
Dan Finn, aye.
Austin Magnan, aye.
Bill Muller, aye.
Jen Maynard, aye.
Karen Gwizdowski, Govin, aye. All right, September 12th, 2022.
Okay, since I'm still off mute, I'd like to make a motion to accept the September 12th, 2022 minutes as written.
This is Austin Magnan. I will second that motion.
All right, roll call vote.
Dan Finn, aye.
Austin Magnan, aye.
Bill Muller, aye.
Jen Maynard, aye.
Karen Gwizdowski, Govin, aye. All right, October 24th, 2022.
This is Dan Finn. I'd like to make a motion to accept the minutes as written for October 24th, 2022.
This is Austin Magnan. I will second that motion.
Roll call vote.
Dan Finn, aye.
Austin Magnan, aye.
Bill Muller, aye.
Jen Maynard, aye.
Karen Gwizdowski, Govin, aye. November 14th, 2022.
This is Dan. Again, I would like to make a motion to accept the minutes of November 14th, 2022 as written.
This is Austin Magnan. I will second that motion.
Roll call vote.
Dan Finn, aye.
Austin Magnan, aye.
Bill Muller, aye.
Jen Maynard, aye.
Karen Gwizdowski, Govin, aye. December 12th, 2022.
This is Dan Finn. I'd like to make a motion to accept the minutes as written for December 12th, 2022.
This is Austin Magnan. I'll second that motion.
Roll call vote.
Dan Finn, aye.
Austin Magnan, aye.
Bill Muller, aye.
Jen Maynard, aye.
Karen Gwizdowski, Govin, aye. All right, January 9th, 2023.
This is Dan Finn. I would like to make a motion to accept the minutes of January 9th, 2023 as written.
This is Austin Magnan. I will second that motion.
All right, roll call vote.
Dan Finn, aye.
Austin Magnan, aye.
Bill Muller, aye.
Jen Maynard, aye.
Karen Gwizdowski, Govin, aye. And finally, February 6th, 2023.
This is Dan Finn. I'd like to make a motion to accept the minutes of February 6th, 2023 as written.
This is Austin Magnan. I will second that motion.
Roll call vote.
Dan Finn, aye.
Austin Magnan, aye.
Bill Muller, aye.
Jen Maynard, aye.
Karen Gwizdowski, Govin, aye. Thank you, board members.
And thank you, Nancy, for putting all
Yes,
this together.
thank you, Nancy, for finding some time to put those together. In your
You have
spare
help.
time.
It helps with the new girl in the office, let me tell you.
No, I'm sure. I can imagine.
Mhm.
All right, old new business. We already touched on a little bit during my beginning spiel. And we touched on a little bit last meeting where as of now, up through March 31st, we can do fully remote meetings according to the open meeting law provision. But as of this weekend, I didn't see that they had extended that yet, but I know when the last time rolled around, I think it was in July of 22 that they extended it. They did it like a week before the deadline. So I know Nancy, after last meeting, was gonna dig in and get us room, number one, because if they don't extend it this time, then we have to, at a minimum, go hybrid, where some need to be in the room and some could always be on remote, or we could be fully in the room. I'm not saying we have to be on Zoom. I'm just saying that no longer would we be able to be just fully remote without being in a room. So I know when I saw the agenda go out, it looked like we had a conference room for the next 3 meetings. And then Nancy, we can figure out like what the protocol is in terms of how other meetings are doing this with a whole kind of hybrid thing with the setup in the room, et cetera, if we get to that point. But figured I'd throw it out there that at this point in time, nothing has changed. I didn't have any other old or new business. Oh, Dan?
Yeah, just one piece of information, old business. I've been working with, had a couple of meetings with Sarah Darlagianis, who is part of Region 2 as a planner and trying to get our EDS emergency dispensing site plan of 2023 together. And she adapted it from the state plan and added a couple of things. And so I sent it off to Bill to take a look at. And we have until the middle of June to actually get it done. It might be June 30th, but we're shooting, and I think we can get it done within a month or two, actually. And update the various people is one of the things, the various important people in their contact information and stuff. But the nice thing about this plan is that it's actually a digital thing. I mean, you could print it down, but it's digital to the point that you can change names, say as there's a new select board chair next year, et cetera, and people move around. So anyway, that's just an update on that stuff.
Appreciate it. All right. Didn't have any additional mail or correspondence. And then upcoming meetings, all currently planned to be both in person and Zoom. According to the agenda, are April 3rd, May 1st, and June 5th. All right, so that's all we had for topics today.
Yeah, 7:19. I don't know if that's true.
Yep.
So I'd like to make a motion to adjourn this meeting.
Is there a second?
This is Austin Magnet. I will second that motion.
All right, roll call vote.
Dan Fan, aye.
Austin Magnet, aye.
Bill Muller, aye.
Jen Maynard, aye.
Karen Gwiazdowski, Govan, aye. Thank you, everyone.
Yep.